What is chronic kidney disease? Within our body, just tucked under our ribcage, we have our kidneys. Your kidney's main job is to filter and clean out the waste products from your blood. The kidneys are packed with tiny little filters that keep the good stuff in the blood and wash the bad stuff out, creating urine which comes out when you wee or urinate. But sometimes these tiny filters inside the kidneys can get damaged and do not work as well as they should. This is called chronic kidney disease, or CKD for short. Chronic is just a medical word that means it's a condition that lasts for a long time. It is a common condition affecting up to 1 in 10 people, especially as we get older, and is more common in people who are Black or of South Asian origin and in women who have gone through the menopause. This means that 25 in 100 people in the UK over the age of 65 will have chronic kidney disease, CKD. People can have different levels or stages of chronic kidney disease. In the early stages, a person with CKD might feel completely normal and have absolutely no symptoms. Because of this, doctors have to use simple blood and urine tests to check if the kidneys are doing their cleaning job, the filtering properly. What causes chronic kidney disease? CKD doesn't just happen out of nowhere. It is mostly caused by other health conditions that put a heavy strain on the kidneys, forcing them to work much harder than they should. Often it's actually a combination of a few different problems that wear the kidneys down. The two biggest causes are high blood pressure and diabetes, which together are responsible for up to 2/3 of all chronic kidney disease cases. You can think of high blood pressure like water rushing way too hard through a delicate garden hose. Over time, that intense pressure puts a huge strain on the tiny blood vessels inside the kidneys and stops them from working properly. Pre-diabetes and diabetes, on the other hand, mean that there is too much sugar in the blood, and having too much of sugar floating around in the blood for a long time can actually damage those delicate tiny filters inside the kidneys. Another cause is high cholesterol, which also floats around in your blood, leaving sticky, fatty deposits in the blood vessels, making it harder for blood to flow through, making it harder for the kidneys to work properly. Nasty kidney infections or kidney stones can damage the kidneys, as can some certain medicines if taken over a long time, such as ibuprofen or naproxen tablets. Rarer causes include a genetic disease called autosomal dominant polycystic kidney disease, ADPKD. And this disease affects somewhere between 1 in 400 up to 1 in 1,000 people. This condition is inherited from your parents, meaning it's passed down through your family. And lastly, very rarely, some people develop an inflammation of the kidneys that can damage the kidney's ability to filter the blood properly. Because lots of different things can strain the kidneys, making healthy lifestyle choices and making sure other health problems are controlled is the absolute best way to protect the kidneys and keep those natural blood filters working well.